Welcome to Our Toxic Nation, a call for Reformation Summit. I'm your host, Rachel Roshek, and I'm excited to announce today's guest and topic today with Dr. Myriah Hinchey. Welcome.
Hi, thanks for having me.
Thanks for being here. I appreciate it.
Absolutely.
The topic today is Lyme disease, but first I would like to introduce you to our audience. Dr. Myriah Hinchey, a naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs, is a recognized expert in the field of Lyme disease and other complex chronic inflammatory conditions, with over 17 years of specialized experience. As a physician and the medical director at TAO, an integrative center for healing, she has successfully guided thousands of patients towards recovery from their complex chronic inflammatory conditions. Additionally, she is the founder and owner of Lymecore Botanicals, an herbal medicine company focused on providing effective solutions for healing vector-borne diseases. Dr. Hinchey is dedicated to treating patients of all ages with a specialty in pediatrics and is also a sought-after speaker, passionately educating healthcare professionals on the pathophysiology of vector-borne diseases and how to successfully integrate functional herbal and lifestyle medicine into their practices. So, Dr. Hinchey, what is the incidence of Lyme disease in the United States?
So the CDC estimates that it is just shy of about 500,000 cases a year. There's some new research that Medicare put out that suggests that number could actually be about 7 times greater, which would be over 3 million cases a year.
Wow.
Yeah, and that's just Lyme. That's not any of the co-infections that can also be transmitted.
Wow. What are the symptoms or the common symptoms of Lyme disease?
So Lyme infects every cell in the body, therefore it has the potential to affect every cell, every organ, and every organ system. So it really depends on the individual and it depends on like their genetic weaknesses as well as structural weaknesses, but it can range from, systemic things like fatigue or chills, sweats, headaches, muscle pain, muscle weakness, muscle atrophy. It can cause a lot of behavioral and cognitive issues. It can cause issues with the bladder or with the heart or with, the lungs and the respiratory system. So, there really isn't any part of the body that's off limits. And again, it's going to go after the weaknesses. I would say some of the hallmark symptoms of Lyme disease are immune weakness that gets worse over time, poor wound healing. So if you have surgery or an injury and you're not recovering at the rate that your doctor expects you to, also getting diagnosed with atypical anything. So atypical to me is a huge red flag. We have diagnostic criteria for a reason. And if you're not meeting that, you should really keep pushing, for an answer that does make sense. Lyme is the great mimicker or the great imitator, and it masquerades at a lot of other diseases and diagnoses.
And it's funny, as a Lyme patient, I've learned that it's almost never just Lyme disease. So, what are the other co-infections?
So the most common co-infections are Ehrlichia, Anaplasma, Babesia, Bartonella, Mycoplasma, Chlamydia pneumoniae, Powassan virus. Those things can be actually transmitted by vectors, so by ticks. But I also, when I'm working up a patient, look at the other opportunistic infections that can already be inside of a patient. And because of the immune compromisation that these vector borne diseases like Lyme can cause, a lot of times we'll see other things like Epstein Barr or other herpes family viruses, candida, other bacteria or organisms or viruses actually increase in their load, and then we can't ignore them either.
Got it. How do you differentiate between the hallmark symptoms of Bartonella, Babesia, and Borrelia?
Well, it's hard because there are a lot of overlaps. So I kind of went through, the very vague classic symptoms of chronic Lyme. And by the way, I do want to say, like in an acute Lyme case, a lot of times it's just symptoms of the flu. And a lot of times the rash is not there. So many sources show that EM or bullseye rash is there less than 40% of the time. So we cannot get obsessed with relying on the presence of that rash to diagnose Lyme like a lot of clinicians do. But if that rash is there, it is diagnostic of Lyme disease, no matter what your test says. So I think that's just really important for your listeners to hear. Okay. But when we're looking at Babesia, Babesia causes a lot of very interesting symptoms. I would say one of the hallmark symptoms is profuse sweating. So this can either be night sweats at night or it can be during the day. And a lot of times it's drenching. A lot of Babesia patients will develop shortness of breath or air hunger. There can be a strange chronic cough or a lot of chest or rib pain. There can be a lot of psychiatric issues with Babesia, a lot of anxiety. And there can be this weird sort of depersonalization or out of body or clumsiness or dizziness where the patient feels like they're walking on uneven flooring or kind of like they're drunk when they're not. And then I would say, contrasting that with Bartonella, Bartonella can cause ice pick headaches, which, if I didn't say it, Babesia causes more of like a global pressure or tension headache. But Bartonella has a lot of neuropsychiatric symptoms. And sometimes, especially in kids, there are more brain, central nervous system, psychiatric symptoms than there are physical symptoms. Bartonella can cause this weird buzzing in the whole body or like strange twitches or like these pains that are fleeting and go away as quickly as they came. There can be this weird stretch mark or striae rash. It's called the Bartonella associated cutaneous lesion. And basically, it looks like stretch marks, and they can kind of come and go and move around the body. Trying to think if I'm forgetting anything with pain in the soles of the feet or the heel that can often be misdiagnosed as plantar fasciitis. And again, I'm not saying it's any of these one or two symptoms. It's when you start seeing that whole picture. So really, for clinicians, the pattern recognition of these various infections is really key to the diagnosis.
Got it. That sounds very complicated. Why are there so many misdiagnoses? Because of the complex nature of these diseases?
I think there's a lot of things that play into it. So I think that there is, kind of at the forefront, just ignorance when it comes to knowing what the symptoms are and what the tests mean. So I think that there is a general ignorance in our medical society. When I went to school, we learned that Lyme disease, I remember the question, like on the clinical exam, a group of children were playing in the tall grass and all of a sudden they had arthritis and bullseye rashes. What is it? Borrelia burgdorferi. It's Lyme disease. What do you do? 2 weeks of doxycycline, everyone's cured. And it's like, no, that's so far from the truth. And we can unpack that whole scenario. But again, I think that it's just a general ignorance to what does Lyme even mean? Because a lot of people just now, put all of the co-infections in there and
Mhm.
call it all Lyme, and it's not, and then we're also hung up on thinking that, okay, well, Lyme is just, on the flip side, Lyme is just Borrelia burgdorferi. And it's like, no, there are so many other species of Borrelia that cause Lyme, and then something else called tick-borne relapsing fever, which is basically kind of like just another branch of Lyme disease. So, if we're not testing for all of the different species of Borrelia, we're not going to have an accurate diagnosis. And by the way, it can't just be a positive or negative test. We need to understand what these tests are showing. And when you're just looking for the word positive or negative, you're kind of missing the boat. So, Lyme and all of these other vector borne diseases really are and need to be and should be a clinical diagnosis. So, this diagnosis is come to by doing a thorough history, review of systems, physical exam, ruling out all of the other scary neurodegenerative, inflammatory, rheumatological, and basically any other system of the body, diseases that it could be, and then using the various lab tests, as looking at the immune system's response to the possibility of this infection being inside of the body. So a lot goes into it. I would say, in addition to those two things, improper treatment. So 14 days of doxy is not going to cover the life cycle of Borrelia. The life cycle is at least 21 days. That is very, very slow growing. And there are reasons why we are put on antibiotics for a certain amount of time. And if you're put on an antibiotic for less days than the life cycle of what you're trying to kill, you're not going to kill it. So I would say when it comes to Lyme disease, one of the most respected organizations is the International Lyme and Associated Diseases Society. You can find them at ILADS.org, so ILADS.org. And their recommendation for an acute case is 4 to 6 weeks of doxycycline, which would ensure that, if you're going to the 6 weeks, that you're actually covered over 2 life cycles. So I would say improper length of time with treatment, and then also delayed treatment. So if you're not recognizing or finding out that you have Lyme disease until several months, or in a lot of people's cases, several years, 4 to 6 weeks of doxycycline, I'm sorry to say, is not going to really do anything to get rid of this infection in most people.
What's the proper testing for Lyme disease and co-infections?
So I think the easiest way to think of it is you're only going to get an answer for what you know to test for. So if you're using a conventional lab like Quest or LabCorp, or a traditional hospital lab, and they're only looking for Borrelia burgdorferi, that is the only thing that you are going to get an answer to. So you have to be thorough and look at the other like 18 species of Borrelia that cause Lyme and or tick-borne relapsing fever. You then have to actually look at all the testable species of Babesia, Bartonella, um, and then in addition to that, looking at Anaplasma, Ehrlichia, Mycoplasma, Rickettsia. There's a multitude of other co-infections that are present in the blood meal that this tick takes in prior to biting you.
Got it. So how does Lyme and the co-infections become chronic?
So in addition to, improper diagnosis, so delayed diagnosis, as well as improper treatment, I would say that it has to do with the way that the infection stimulates an inflammatory cytokine cascade, which basically leads to an improper functioning in the immune system and leads to what's called immunoincompetence, where the body can no longer see or know how to destroy the infection. And these infections are really good at manipulating our body's immune system to work for it instead of for us. So, one of the simple things to explain is living behind a biofilm. So, Lyme actually encourages the formation of biofilms, which is a fort like structure that Borrelia and other infections, other bacteria use to basically wall themselves off from the immune system and hide behind. So now the immune cells literally cannot get past this wall and cannot resolve the infection. Additionally, the medications that we typically use to try to kill these organisms cannot reach the infection and therefore they can't work. So, an important part of a treatment protocol needs to be something that's going to tackle these biofilms and break them down. Additionally, Borrelia likes to live inside of cells as well as outside of cells, and then it's able to basically roll itself up into a round body or a cyst form that actually does not respond to any of the intracellular or modal form antibiotics used to treat it. You actually have to use things that will bust up the cyst.
So what is your approach to treatment?
My approach to treatment is really figuring out what is going on in the person sitting in front of me. So, this is not as easy as just identifying and killing the infection. So, a lot of times, by the time a patient has come to me, they have been chronically ill for years. They've been misdiagnosed. A lot of them, once they've found their diagnosis, have been on a insane amount of antibiotics and they've been on them for great lengths. And so a lot of them have a lot of gut dysfunction going on. They have a lot of permeability issues where they're with their gut where their body isn't holding the things that aren't supposed to be allowed in the body outside of the body. So everyone forgets that our gut is there to digest, right? Everyone remembers that part, but people forget that the other main function of our gut is to actually allow waste and toxins to be dumped into it. And then we eliminate it out of the body, through our stool. And so when we have permeability issues in the gut, we will actually become more toxic. We allow toxins and other pathogens that we would never allow into our bodies in. We allow antigenic food particles because we end up with digestive issues. And now the immune system is reacting to all of those things. And it's further increasing inflammation and toxicity and oxidative damage to cells, which weakens the person and causes further damage. So it's like we have to figure out what is going on inside of that person as far as their toxicity, their oxidative stress, their mitochondrial function. We need to heal the gut. Something that I could literally spend an entire hour talking about is that 90% of our immune function is in our gut and determined by our gut. And when our gut is toxic and not functioning properly, you cannot have a properly functioning immune system. And there's no amount or length of antibiotics that gets a bacteria to zero. Antibiotics shrink the load of infections. Yes, 100%, absolutely. But in the end, it's the immune system that has to come in and fully eradicate that infection from the body, or at least hold it into remission by not letting it replicate. And for me, this is the huge crux of chronic Lyme disease. How do we restore proper immune function and gut function if we're using pharmaceutical antibiotics to kill this bacteria, right? Like it's
Right.
a double-edged sword,
Yeah.
it's a conundrum.
Yeah.
So in my practice, I'm working on all of the lifestyle things. So, managing stress, managing their nutrition, making sure their food is not acting as poison. I make very few blanket statements, but one of them is no gluten, no dairy, no sugar, no processed food, because it's going to cause inflammation, which feeds the infection, and it's going to suppress your immune system. And again, in the end, the number one piece is restoring immune function to be able to stop this infection from growing back once the antibiotics are stopped. So I use a lot of herbal antimicrobials. And fortunately, over the past 4 years, we've had a lot of studies come out that have looked at certain herbal antimicrobials and compared their effectiveness to that of very commonly used antibiotics for Borrelia, as well as Babesia. There was another separate study with Babesia. and which, by the way, requires antiparasitics, not antibiotics, right? Antibiotics are for bacteria. Babesia is actually a parasite. Um, but basically, what I do is I use these proven studied herbs to shrink the load of the infection while doing all of the individualized things to repair the gut, get the person detoxing, get the person's nutrient status where it needs to be, and kind of like heal the body, recover the immune system. And then when all of that is settled, we can actually stop the antimicrobials and the infection doesn't grow back.
Wow, that's a lot to take in. It sounds like it can be a vicious cycle for people.
It is a vicious cycle. And I would say that, once you have chronic tick-borne disease or chronic vector-borne disease, chronic Lyme disease, whatever you want to call it is no longer the root cause of your problem. It has caused all of these other root problems. So, like, I have this diagram that I use to educate other clinicians, and it's an iceberg. And so you see the tip of the iceberg sticking out of the water. And to me, that's where all the vector borne diseases are. And then you see the whole bottom of the iceberg, and that's, the inflammation, the immune dysfunction, the gut dysfunction, the impaired detox, the oxidative stress, the mitochondrial dysfunction, cell danger response, like all hormone imbalance, right? I mean, we cannot have a healthy functioning immune system if our estrogen, progesterone,
Yeah.
testosterone, all of those things are imbalanced, right? So it's like doing a really good functional medicine workup that is literally individualized to the person sitting right there in front of you. And it's like all of those things have to be taken into consideration and healed. Then you can get the tick-borne infection out of the body.
Wow, our modern lifestyle certainly doesn't support, makes a breeding ground for Lyme disease.
It sure does. All of the glyphosate in our food, all of the genetically modified foods that we eat that our body doesn't even know, what it is, all of the ultra processed foods and the seed oils and, all of that stuff, really what it does is it drives the inflammation. And
Mhm.
it's that inflammation, by the way, that causes all of the symptoms. Anything pain is generally inflammation, right? So all of that pain, cognitive dysfunction, it's all inflammation. And then it's also the inflammation that feeds the infections by breaking down the collagen. And it's the inflammation that really breaks the immune system. Oh, and by the way, helps them to form these biofilms and hide. So
Mhm.
it's crazy, that we ignore what an impact what we are eating has on inflammation and also has on our immune system. And, just to take a step back and generalize this to our chronically ill nation, right, that we're all a part of,
Yes.
at the heart of diabetes, cardiovascular disease, obesity, autoimmunity, cancer, what drives it all? What does it all have in common? Inflammation and immune dysfunction. All of it.
Yeah.
So I think that if we all started paying attention to what we put on and in our bodies, our immune system and our ability to handle all of these organisms would be very, very different. We talked about the obvious toxins in our foods, toxins in our air, water. I mean, I think it's pretty obvious to people that fragrances and cleaning products, right? And all of those things have toxins. But like we don't even think about all of like the electromagnetic radiation and all of those toxins and how listening to the dismal, damning, media constantly
Yes.
bombarding our nervous system with all of these toxic, excuse me, sorry, I get like really riled up, fears and,
Yeah.
like literally polluting our brains with like this ominous feeling that like, we're all going to die. Like, how does anyone function like that?
Not well. They probably need to come see you.
Well, I can't see everyone. I have a lot of really great colleagues, that are very helpful, but I am so hopeful with our, I don't want to get political, but I'm very, very hopeful with our new administration and, especially with RFK Jr., leading the HHS. And, I'm just so hopeful that, he is going to be able to clean up our food and, clean up our world. So him and President Trump, rooting for you guys.
Yeah, no, I'm with you. And to me, it's not a political statement, it's personal. I lost close to 20 years of my life to misdiagnosis and just a unsupportive, unwilling, and uncurious medical system.
Yeah.
So,
I'm so
yeah.
sorry for you and that you had to go through that. I wish that
All
your
right.
story was not the atypical story. You know what I mean? It's
Yeah.
unfortunate, and I know the more people you talk to, the more people you're like, yeah, it's different version of the same
Mhm.
story.
Absolutely. Yeah, it seems like well, look at the way we live, the way we eat. It's just become so commonplace now, and it's acceptable. And it really shouldn't be. Our food is not clean, our water definitely isn't clean. It's vicious cycle, and we wonder why we're all sick.
Right.
So, well, where can people reach you if they'd like to reach out?
Sure. So kind of like my parent site would be drhinchy.com. So if you go there, you can find links to my clinic, which is Tau Vitality. You can find links to my educational platform, which is Lyme Bites,
Mm,
and then also my botanical medicine company, which is Lyme Core Botanicals.
great. Thank you very much. I think I've attended a few symposiums from you before or summits. So thank you for everything that you do. And thank you for agreeing to be here today.
Of course, it was my pleasure. I want to get the word out to as many people as possible, and I appreciate you inviting me to use your platform to do so.
Of
Good
course.
luck with everything.
Thank you. Take care.
You too. Bye-bye.